Tulsi Gabbard, Representative Tulsi Gabbard, came out with her position on healthcare reform and what her view on Medicare for All is. Now, she has been somebody that has said she supports Medicare for All, and she supports Bernie Sanders' position and all that stuff. Now, she does believe, she has said in the past that she agrees with a form of healthcare or healthcare system or healthcare options, so that you can at least have supplementary care for certain, like I said before in past podcast segments, I pointed out how she believes in getting supplementary care for things like chiropractic work and plastic surgery, stuff like that. Things that maybe regular healthcare companies, or even a Medicare for All system, doctors, they don't want to cover, not healthcare companies. Just they it's not covered. It's not going to be. It's not something that would be covered under Medicare for All, because it's not something that's considered like a health issue. So like plastic surgery, no, it's not a health issue. Chiropractor work, maybe people just don't feel like it's legitimate, and so they don't want to do that. Some forms of physical therapy apparently aren't covered. So it's kind of an issue that might come up with through Medicare for All. So anyway. It seems like, though, Tulsi Gabbard changed her position on where she stands with Medicare for All. Now, she may deny that, but it seems, based on the evidence that we're being shown here, that is the case. Now, I don't want to give too much away. I want you to listen to her state what her position on healthcare is. This is during an interview that she did with it was a radio station. WBUR. This is a station in, I'm not sure where it's located, but anyway, it's a radio station somewhere, and they did an interview with her talking about all different kinds of issues, and so they asked her about healthcare. So why don't you listen to her response here, and then we'll talk about it and expand and give a little bit more details on the other side.
When you say healthcare, are you for Medicare for All? If you can just tick through the list more specifically.
Yes, I prefer to call it Medicare Choice, where we are ensuring quality health care for all people, regardless of how little they may have in their pocket or their bank account, while maintaining their freedom of choice. If they've got an employer-sponsored plan or a union-sponsored plan that they're happy with, they should have the opportunity to do so. But the bottom line being that in the wealthiest nation in the world, there is no excuse that we still have far too many Americans who are underinsured or uninsured and who are one healthcare emergency away from total financial disaster.
Yeah. So the way I interpret what she said there is that she supports essentially what is very similar to Pete Buttigieg's plan, which I covered on my last podcast, which is, you have a choice. You have a choice to get health care from private care, so from like private insurance. And then if you want to keep it to, you want to get employer-free health care, you want to get employer-based health care and all that stuff, you can get that too, or you as a union or employer, whatever. So, no, that's not Medicare for All. And as you saw there, she called it Medicare Choice. So she almost said, I support Medicare for All. No, but I call it Medicare Choice. So what you're basically saying you support is you support a public option. So I am not a anti-Tulsi person. I'm not going to come out here and smear Tulsi. I'm not going to call her a liar or a deceiver or non-progressive. I think she's very progressive on many issues. On this one here, I don't know. Something happened where she decided to take a position that just is not the same thing as she claimed before. Now, before, like I said, she believed in supplementary care. Bernie supports supplementary care. But now she's saying, I support Medicare Choice. And that's just not good. That's not a good answer to give. That's not something that I can back. I support Medicare for All. I support Singlepayer. Now, people are responding to a lot of the people that support Tulsi Gabbard. I'm not going to name any names. But a lot of people that support Tulsi Gabbard, they're coming out and saying, well, this is the same kind of care they get in Europe. They have private care options. They have, they have private care and public care options. They give options. Listen, I don't give a shit what they do in Europe. Now, that doesn't mean that their system isn't good. But I don't care what they do in Europe. I don't care what they do in Germany. I don't care what they do in whatever countries people have been mentioning. I care about what Bernie Sanders is pushing for. I care about what Medicare for All is. Medicare for All is what we need. We don't need Medicare Choice. And anytime that you have a private insurance option, which is a rapacious, for-profit middleman, that wants to screw you over. Anytime you have those people involved in this kind of system, specifically healthcare, even if it's in a choice thing, even if it's a choice matter, anytime you have that there, you're giving those companies a chance to fuck you over. And they will, by the way, of course, which they do already. But you're giving them a chance to keep their foot in the door, put their foot in the door and be like, oh, okay, I still have a chance to get involved in the healthcare system and continue fucking over people like Blue Shield and Aetna and whatever it is, Pfizer and all these different companies, Blue Cross Blue Shield, all these companies that they're doing to people, like the way they fuck over people, they still have a chance to do it. But you have a public option too. Now, as Cenk Uygur explained before, and I've talked about before, and I played the clip before, what they do with the people, what they do with the with the people that within that kind of public option, private option system, is what they do is they put all the healthiest Americans on the the private insurance. And then they put all the sicker people on the public option, so the kind of the Medicare for All option, although it wouldn't be all, it would be the Medicare option or the public option. And then they end up putting all the sickest people there, and then that takes up all the costs. It fucks up the insurance pool, and then people end up getting screwed over because they end up getting poor quality care, and then the right wingers or the people say, oh, look how terrible the public option, look how terrible Medicare is, Medicare is terrible, it's not good enough, we need private care is better. So that's not what we need. We don't need to be told about how wonderful private care is, because whatever, great, it works for the rich people. People get private care. Yeah, of course private care is good because you're paying a ton of money for it. But a lot of people in this country don't have a ton of money. That's why they need to have public. They need to have public insurance. Well, not public insurance. They need to have Medicare for All. They need to have Singlepayer, which is a public form of healthcare. And whether it's private funding of public institutions or public funding of private institutions, whatever it is, there's different versions of it in different parts of the world, in Europe and Scandinavia and stuff. But the point is that in Canada and UK and all that stuff. But what it comes down to is you need to have a single payer system where there is zero profit motive involved in the healthcare market. There doesn't need to be any kind of competition for which healthcare company can screw you over more. And when you put that private option in there, you're basically saying, yeah, an option for me to get, for me to have shittier care. And when you're talking about you might have great insurance under your, your employer. Okay, that doesn't help because that's not a good thing, because at the end of the day, you're spending money on that. So this Pete Buttigieg put out a plan. Oh, you're going to spend, I'm going to be able to spend, because he wrote an op-ed, which I covered last podcast. He says, oh yeah, people with, so-and-so, whatever, under my so-and-so plan are going to have to pay, based on the income, they're going to have to pay, one person said, I don't know how much the income was, but you're going to have to pay $354 a month. It's like, what the hell? Like, that's how much you're going to fucking pay for healthcare per month? That's ridiculous. And is it even good quality care? That's the question. But when it comes to the idea of employers, it costs them a ton of money too. Not only it costs, obviously, the person who's paying for the insurance, but it also costs the company money too. Whereas if you have a single payer system, it's reliant on the government. The company doesn't have to get involved. They don't have to insure you at all. And you also don't have to worry about getting fired and then losing your insurance. What if you get fired? What if you have to quit? What if you're moving jobs and your other job doesn't have as good quality care? So that means you have to stay in your shitty job that you don't want to be in because of your insurance, because of your health care. I mean, that's fucking, what is it? What is this, like a fascist theocratic system we're involved here? It is. That's technically what it is. So they force you to stay in the system just so they can keep giving healthcare and keep charging you, up the ass for care for healthcare that's not even that good. And then they charge you all this money, and then it costs the company money, the company that you're working for too. So anyway, So this whole thing about Tulsi being in favor of Medicare Choice is interesting. Medicare Choice, quote unquote. It's interesting because her own website says that she supports Medicare for All still. Now, from what I saw on her website, it doesn't have Medicare Choice on there. But if it does, she still says she supports Medicare for All. And let me just read you the key points here. It kind of says the same shit. It's the same kind of shit she's always said, but let's just reiterate it so people, so she's on the record and people, you guys know what I'm talking about. And it says, she lists a bunch of key points. She says, Tulsi strongly supports the Medicare for All Act and serves on the Medicare for All caucus. Tulsi believes that our present healthcare system is organized by and for the benefit of big insurance and pharmaceutical companies and not the American people, which must be changed. We pay for far more in this country on healthcare costs than any other country in the world and get worse results. Far too many Americans in this country are sick and unable to get the care they need. Tulsi supports Medicare for All to make sure that every American gets quality healthcare. We must also focus on reducing the cost of healthcare overall, preventive health, bring down cost of prescription drugs by allowing Medicare to negotiate those prices down and ensure transparency so people know exactly what the cost is and what they are paying for. Tulsi believes that the Affordable Care Act was a step in the right direction, but points out that issues remain with the number of uninsured and high costs related to deductibles, co-payments, and medical services and prescription drugs. I mean, honestly, right there, she's pretty much sounding just like Bernie Sanders. This is from her official website. I'll put the link in the description box for you guys to check out. This is from her own website. And all of a sudden, now she's talking about Medicare Choice and talking about people have to have a choice. People have to have a choice to be on their private insurance so they can keep paying high fucking deductibles. And then all the sickest people are going to be put on the, public healthcare, and then all the healthiest people are going to be put on the private healthcare. How the fuck does that help anybody? And how the fuck does it help for the company that you're working for to keep paying for your healthcare, and then you have to rely on, you gotta hope you don't get fired from your job so that you keep your healthcare? No, that's terrible. And it's not going to, again, you let those private companies, the private insurance companies, you allow them to have the foot in the door. It's going to keep giving them a chance to screw people over in this country and not give them quality care. That's the bottom line. And you ask any progressive that is the truth. And I would think Tulsi knows this, but I don't know. Apparently she doesn't. And then her website even points out all the progressive legislation she's voted for too. So the progressive legislation that's essentially like helping to further push like Medicare for All. So it says Tulsi is a co-sponsor of HR 1384, Medicare for All Act of 2019, which would provide universal health care to all Americans. I believe that might be Pramila Jayapal's bill, which is actually better than Bernie Sanders' bill in the Senate. HR 4442, Connect for Health Act to promote cost savings and quality care under the Medicare program through the use of telehealth and remote patient monitoring services. HR 465, Prescription Drug Price Relief Act of 2019 to significantly lower prescription drug prices for patients in the United States by ending government-granted monopolies for manufacturers who charge drug prices that are higher than the median prices at which the drugs are available in other countries. HR 448, Medicare Drug Price Negotiation Act to amend Title X, XVII, which I believe is 8, Title 8 of the Social Security Act to provide for the negotiation of lower covered Part D drug prices on behalf of Medicare beneficiaries. Sorry, it's an XVII, which means like Roman numerals. I think that means 8 though. HR 676, Expanded and Improved Medicare for All Act. Okay. HR 447, Affordable and Safe Prescription Drug Importation Act. So listen, her record shows that she is in favor of Medicare for All, but this whole Medicare Choice thing doesn't make a lot of sense. I don't know what happened. She went on naval, I think it was naval reserve duty, military reserve duty, and for like 2 weeks or something, she went and did a show with Dave Rubin, who's a right-wing grifter funded by the Koch brothers or whatever, and she went on these different, things, and then she went on, like I said, she went to do her military service and stuff. I think it was for 2 weeks. I think she went to South Korea, I want to say. But anyway, she did all these things, and all of a sudden she comes back and she has this honestly really completely different position on healthcare. And It doesn't make any sense. I don't know who she spoke to. I don't know who told her to do this. I don't know who told her this is a good idea, but it's not. And I love Tulsi, man. I support her. I am not I'm not one of the people that smears her and attacks her and says she's a right winger or loved by the white supremacists or I don't know sucking up to the Indian fascist, Indo-fascist, or whatever the hell they call them, which is referring to Prime Minister Modi of India, which I don't have a lot of knowledge on what's going on regarding that. I spoke about the Kashmiri, the stuff that's happening in Kashmir and the Kashmiri people. But yeah, as far as when it comes to Modi and stuff, I just know he's like a fascist leader of India. And she's met with him and stuff though. But it seems to be like the same attacks that they use when it comes to Assad and how she's met with Assad. So I don't know. I don't put a lot of credence into those smears against her, and that's not something I'm gonna give airtime to on my show. But when it comes to this specific policy, it looks like she flip-flopped, and I wouldn't have expected this from her. Before I defended her, I did this segment. You guys can go check it out. I did a segment where I said, she's actually. She seems to still support supports Medicare-For-All, but she also believes in supplementary care. That's what seemed to be the case, and it was the case. But all of a sudden now it seems like that was a little bit of a kind of a tiptoe to the right, and this is even like a big step to the right, in my opinion. And she basically wants to do what Pete Buttigieg does and keep the healthcare, the public option as a private option there with the public option, and that's really unfortunate. The only thing I can give credit to her for is at least she's not calling it Medicare for all and then having like a public option and private option, which Kamala Harris is doing, which is disgusting. I can't stand it. And she's just totally shameless in her grifting and her lying, essentially. But at least I can give credit to Tulsi for at least naming it something else. But I still don't agree with the policy, and she needs to figure out a different way of doing this. I mean, maybe she's trying to differentiate herself from Bernie. It's possible, and I understand that. And she has to, she's the one. She wants to become president, right? She's not running for nothing. She's running for a reason. She doesn't want to say, "Yeah, I'm with Bernie," like Warren is doing. Which, in my opinion, what Warren is doing is worse because she's going on pretending that she's in favor of Medicare for all. She doesn't even have her own healthcare policy. When she claims, "Oh, I have a plan for that. I have a plan for that," but she doesn't. So it's bullshit. So, yeah, she needs to. I don't know. She needs to change her position on this. She needs to backtrack big time or whatever, change it. I don't know. Whatever it is. But it's just, if you're trying to differentiate yourself from Bernie, I get it, but this is not the way to do it. And Tulsi is a lot smarter than that. So we'll see what happens. Maybe she'll do it. Maybe she won't. But at the end of the day, we need to get rid of the private healthcare system that is fucking us all over. And once we do that, we can actually have people getting decent, affordable health care that is not going to be beholden to the rapacious, for-profit, greedy insurance companies that all they want is our money and giving us shitty care while basically keeping us in our jobs because they're giving us our healthcare through our employer, and then God forbid if we lose those jobs, then we don't even have healthcare anymore. It's like they want to keep us on that insurance bandwagon, and we shouldn't have to be on there. We should have one type of single payer, government run Medicare for all system, and because that's going to be the best type of system that's going to help us, just like it is in every other industrialized nation.